In this lecture, we're going to cover the Herpes viridae family and other serologically diagnosed viruses. The Herpes viridae family is a family of DNA viruses that are linear double-stranded DNA. They're enveloped and their icosahedral capsid is enveloped in them. They all exhibit latency. They're all lifelong infections, which means they don't go away, and include Epstein-barr virus, Cytomegalovirus, herpes simplex 1 and 2, and varicella zoster. So let's start with Epstein-barr virus. Epstein-barr virus is the causative agent of infectious mononucleosis. When you've ever heard of somebody that may have, oh, I have mono, or my son has mono, this is what they're referring to. It's from the direct contact of saliva of the infected person. You can get this from drinking glasses, straws, kissing, sometimes it's called the kissing disease, but not through the air or blood, okay, just saliva. It can cause infectious mononucleosis, it can cause Burkitt's lymphoma, and nasopharyngeal carcinoma, so it can cause some pretty unfortunate type of cancers as well. Symptoms usually begin 30 to 50 days after exposure, and it is found worldwide. And it's interesting that 95% of adults are seropositive, so if you're an older adult, you've probably been exposed to this at some point in your life. Maybe you got a very mild symptom, thought you had a cold or something like that, where some people can get have a pretty severe infection with it. Those that have it in a more severe circumstance usually have malaise, which is generally just not feeling well, having a sore throat, enlarged tonsils, fever, swollen glands, and even in a large spleen or liver. We can have hepatitis occur with this. So we need to take care not to rupture the spleen because it's very tender in this circumstance. Symptoms can last for even 1 to 2 months. Viruses remain very latent for life, which means they can sit pretty quiet, and they can actually reactivate later on. Saliva contains the active virus, and symptoms usually rarely return, but you can actually become positive later in life. Next, we'll talk about some heterophile antibodies. These are antibodies that react with antigens from 2 or more species in a pattern without evolutionary relatedness. They're usually IgM antibodies. They often react with carbohydrate antigen, and the Paul Bunel antigen is one of these. Now, the reason we bring these up is because these can interfere with the mono test. We're looking for Epstein-Barr virus antibodies, and when we do the monospot test, these heterophile antibodies can create a positive result as well. So what they created was a monospot test that helped get rid of these heterophile antibodies so that it's more specific for the Epstein-Barr virus. So how this test works is that we mix serum with sheep or horse red blood cells. The sheep or horse red blood cells will usually agglutinate with somebody who has mono. A presumptive positive result for mono is found in 10 to 15% of infected patients. Two other types of serum cause agglutination of sheep RBCs. We can have normal patients with an antibody to forceman antigen. We can have people who have serum sickness and react with the antigen on sheep RBCs. And what we can do, and this is how this test works, is that we take the patient's serum and we mix it with the guinea pig kidney. That will absorb some of those interfering antibodies, so it only reacts with those causing the infectious mono. Cytomegalovirus is our next one, or CMV it's referred to. 50 to 80% of adults by the age of 40 will have an antibody to the CMV because they've been exposed to it. Most of them are asymptomatic, but some can cause cold and flu-like symptoms. Very similar to infectious mono. The only time this becomes a huge problem is if somebody's immunocompromised, especially somebody who's just received a transplant. These allograft recipients, it can be very, very dangerous. So I have a tag from a unit of AB positive blood over here, and you can see it says CMV negative. Units of blood are tested for CMV, and patients who are immunocompromised or have received a transplant will receive CMV negative units of blood. Other people that can have issues with it, people with HIV or any other lymphoproliferative diseases. Other associated diseases include pneumonia, retinitis, or gastrointestinal disease. We can also have a congenital CMV. This is where unborn babies contract this virus. 80% are born with congenital CMV, are symptomatic at birth, and remain that way. Most are premature. They can experience liver, spleen, or lung problems. They can have a small head size, small body size, or seizures at birth. And there can be hearing or vision loss, lack of coordination, seizures, death. In order to diagnose this, we detect CMV by PCR or viral culture. We test for IgM or IgG to CMV. IgM levels are positive, which means that there's a recent infection or they've been re-exposed. They're undergoing reactivation of a previous infection, or it could just be a false positive. Next, we're going to talk about the TORCH profile. The TORCH profile is a series of tests that include toxoplasmosis, other infections, rubella, cytomegalovirus, and the herpes viruses. Herpes simplex 1 and 2, these are the things that cause cold sores. We call it herpes simplex 1. The genital lesions, depending on the site of infection, is considered herpes simplex 2. Most are minimal with no symptoms, but if you do have symptoms, it could be a painful blister. You can have a burst, which are sores that last 2 to 4 weeks, and often appear 4 to 5 times the first year after infection. Each successive concurrence is usually less severe. The genital infections are quite common. It usually affects 17% of the population, or 1 out of every 6 people between the ages of 14 and 49. Transmission occurs when the sore symptoms are present. Those open sores can also increase risk of HIV. People should abstain from sex with an uninfected person at that time to make sure that they don't spread it. Transmission without active signs, you can have it spread without signs and symptoms, and condoms are the only thing that can reduce that transmission. We can also have congenital herpes simplex virus. This is part of the TORCH profile. A mother with an obvious herpes infection delivers by C-section. Primary herpes can, during pregnancy, really has a high risk to the baby, as you can see by this poor baby over here. Transmission risk is low, but if transmitted to the baby can develop a disseminated disease, and they can have blisters with a red base that burst and crust over, as you can see here. Transmission risk is usually low, but if it is transmitted, they can have central nervous system effects or a disseminated disease that could cause death. Next is the varicella zoster, which you may know of as chickenpox. It's very highly contagious. When I was a kid, if somebody had chickenpox, they'd send all the other kids over there to try and get chickenpox too. When you get chickenpox as a child, it's really not a big deal. If you get chickenpox as an immunocompromised adult or an elderly person, we're dealing with something like you see up on the top right. This is usually spread by aerosols, coughing, sneezing, skin lesions. Infectious, very infectious, 1 to 2 days before the rash appears. It remains infectious even when all the blisters scab over. Symptoms occur 2 to 3 weeks after exposure, and the big deal is when we see these complications with the elderly and immunocompromised. There can be bacterial skin infections when the patient scratches the blisters. Sometimes it can even cause pneumonia or encephalitis. We can have severe complications that need health care, and some even become hospitalized. Varicella can be kind of a big deal with pregnancy. In the first trimester, it can cause miscarriages and birth defects. The third trimester, we can see early shingles infections in the child. So after the resolution, the virus latent in the dorsal root ganglia sit there until becoming reactivated. If you've ever known anybody who has shingles or has had shingles, it's very painful. So here's the shingles. This is when the illness of varicella becomes reactivated, usually in individuals over 50. It can occur in younger people, especially those immunocompromised ones. We can see complications with pneumonia, blindness, and encephalitis, but it does have persistent pain in most cases. The people that I've known who have had it, it looks just like this, and the pain is pretty unreal. It's not just like an irritating outside pain, it kind of like radiates inside your skin. It's contagious, but not nearly as the primary chickenpox. Next one is rubella. This is known as the German measles. It replicates very quickly and most commonly occurs in young children. We see a fever, sore throat, rash. In adult, it can be very similar, but we can see joint pain as well. The biggest thing with this is congenital rubella syndrome. It can cause mental retardation, cataracts, deafness, heart malformations, spleen, and liver damage. All pregnant women are tested for rubella and rubella antibodies to make sure they don't pass this on to their fetus. As you can see by the baby above, it can be quite devastating when a baby is born with this. Next is measles. This is from the Paramyxoviridae family. Mumps and RSV are part of this as well, and it's the leading cause of child death. There was 164,000 deaths in 2008. The Measles Initiative was decreasing. We saw a decrease in deaths due to measles because they really tried to vaccinate more. The MMR vaccine is something that we use to try and vaccinate against the measles. And the thing that's important to know is it's very, very contagious. One case of measles spreads to 12 to 18 people. If a person is not vaccinated and not protected by herd immunity, the person will probably get it. Like if you are anywhere near it, you will get it. And when you hear about herd immunity, that is when significant percentage of population is immunized. So let's say you're in a classroom, right? And everybody but one person is vaccinated. That one person's probably protected because everybody else is protected, so other people probably don't have it, therefore they're not going to give it on to others. If you have many people that are unprotected, and there being around other people that are unprotected, you don't have that herd immunity. So vaccinations are the only thing that can really prevent this. Next we have mumps. This is from the Paramyxovirius as well. It's a single-stranded RNA, and the way we protect against this is from the MMR vaccine as well. You can see the signs of mumps up on the top right. We've got swelling of the parotid gland, which is like a salivary gland. We have ear pain when chewing, difficulty swallowing. There's that big puffiness on the side of his face. It's pretty obvious, you know, it's pretty large. We also have fever, headache, muscle aches, loss of appetite, and fatigue. The next one is West Nile virus. This one came out, oh gosh, I'd say within the last 10 years. This is from the flavivirus. It's a single-stranded positive sense RNA. It's enveloped in one of those icosahedrals again. This one's transmitted by mosquitoes. It normally infects birds, and we've seen crows linked with it as well. And some people can die, or birds can die after infection, which is why you have to be careful when you handle these dead birds. And people can get infected if they're bitten by the mosquito or if they handle infected animals, tissues, or blood. The last one we're going to talk about is the influenza, the Orthomyxoviridae, single-stranded negative sense RNA in 8 segments. Myxo means it interacts with the mucin on a cell surface. That's where we get that myxo from in there. And we often see that there's a change in the flu every single year. So you get a flu shot in 2016, you get another one in 2017. There's changes in the surface hemagglutinin and the neuraminidase antigens. Antigenic drift occurs, and that's why. So the antigens that you see in 2016 are going to drift and change into 2017. So the flu vaccine isn't going to be as effective, or may not be effective at all, if it doesn't cover that antigenic drift. And that concludes our herpes viruses and other viruses.